Good day everyone, welcome back to The Road Ahead. My name is Yue, a first year medical student in UKM and also the MC for today's episode. In this episode, we have the pleasure to invite a distinguished hematologist with us to share her journey in becoming a hematologist. So without further ado, let's invite our esteemed speaker today, Prof. Dr. Nurasyikin. Hello Doctor.
Hi Yue, how are you?
I'm good, thank you Doctor. Okay, so could Doctor please introduce yourself to our audience?
Okay, I am Associate Prof. Dr. Nurasyikin Yusof. I'm a Haematologist from the Pathology department. Actually, Mua Johor born, so I went to school, primary school and secondary school in Mua Johor, and then went to boarding school there, and then I continue my journey for A-level and then do my degree in medical school in United Kingdom, in Bristol, United Kingdom.
So the first question is, after doctors complete your A-level, why doctor want to pursue medicine?
Okay, when I after completed my SPM, Sijil Pelajaran Malaysia, I got offer to do A-level in the UK. In one of the boarding school in United Kingdom called Bedford High School. It's a girls' school under a scholarship program. So and at that time, actually, of course, when you fill in the form, you fill in what subject you want to do. So at that time, I think I've always wanted to be a doctor since I was young. So there was never been a different option, and I got it. To pursue my A-level, so I did sciences subject and one mathematics, and then managed to fulfill the requirement to enter the university in UK, and then continue my journey as a medical student for 5 years in University of Bristol. So it has always been my dream to become a doctor, and the path is there. Of course, I work hard for it to get the requirements. So it was, I think, probably easy. It wasn't difficult for me to choose what degree I want to do. So that's for me lah. Other people might have to think, but it's always been my cita-cita or dream.
Since young.
Since young. Yeah.
Doctor, who influenced you want to become a doctor?
Yeah, because in my family there was never be a doctor actually. My parents are both teachers. My brother did engineering. My sister did textile technology. So I would say I was the first doctor in the family. But I remember being very interested when I got sick. When my parents sent me to the doctor, I would always feel very comfortable, and I think at one time I probably say, I'm gonna be a doctor one day. I probably had that dream when I was young. So I think probably the doctor who take care of me when I was a child, Dr. Ong, I still remember from now, from old time. So I think it was Dr. Ong who has inspired me, I would say. My childhood doctor, always go to the same doctor.
Oh, like a clinic.
Yeah, it's a clinic in Mua Johor. Yeah.
Thank you, doctor, for your answer. And so after doctor complete your medical school, may I know why doctor want to pursue hematologist, like a more lab-based?
Right. Okay. So after I graduated, I straight away come back to Malaysia to serve the country. And then I was offered a housemanship job in HUKM. Now is a new name, right? It's a Hospital Chancellor Tuanku Murphy Place. We used to call it Hospital UKM, HUKM. So I've been in HCTM ever since. So there was a year I graduated 1999, started work 2000. So I've never left this place until I become a specialist. So while doing a housemanship, I was actually started thinking of what I'm going to do and what subject I would like to pursue, to become a specialist. So at the beginning, I wanted to be a pediatrician actually, because I like the pediatric medicine. I always like, and in medical school I always call it in pediatrics. So after completed housemanship for 1 year, that time it was only 1 year housemanship. So I applied to do attachment to try to see which subject that I like most. But I was actually targeting pediatric. So, but unfortunately, when I do my attachment as a MO service MO in pediatric, I realized that the subject is not for me. I think I cannot cope with the emotional part of it, taking care of a sick child. I never realized that it is I become emotionally drained, thinking about the patients even at night, and you feel very, very sad. Especially in pediatric oncology and neonatal ICU. And at that time, my friend, who is now my husband, is always, at the beginning of the work, really working really, really hard, going back very late at night. So I've decided to do lab-based specialist, and I came across a trainee of master in pathology that's doing hematology, doing a posting in clinical oncology medical adult oncology ward, and she was very inspiring. I would not say her name personally, but then I became very much interested in that topic actually. So I talked to some people, talked to the head of department, and then she welcomed me to do attachment in pathology. So I start, after finishing my MO-ship, I started to do attachment in hematology, and I find that it suits me very, very well. It suits my schedule, and after that, I think things just fall into places. So I also applied to do a sort of like what they call a trainee lecturer scheme, and do the posting, and then register to become a student for master in pathology hematology, and then after that for 4 years, masters, and graduated in 2003. So I graduated master in pathology hematology in 2003. Yeah, so I became a specialist, hematopathologist then. And then it's not enough. Not enough. So I pursue again to do a fellowship in Royal College of Pathology of Australasia, and did the exam in Australia, and then attained my fellowship in Royal College of Pathology in 2010. Yeah. And then I become a full sort of like a specialist, a hematologist, as well as a lecturer. Teaching undergraduate and postgraduate in hematology until now.
Okay, doctor. So I have read through the profile of doctor beforehand actually, and I found that doctor is also quite very experienced in doing research, especially in the topic of homeostasis. And then, can doctor please share, why doctor very like to do this topic?
All right. Very interesting question actually, and really much related to my time when I was in Australia doing my fellowship. So when I went there to do my fellowship, I went to the Royal Prince Alfred Hospital, Sydney. During that attachment, one very senior scientific officer, very good teacher, and he is the expert in hemostasis. So he teach me a lot, and I do not know why. Maybe that's a God's will or God's send. I mean, of course, there are many wonderful teachers in the hospital, but he was the one who sort of like inspired me, and because of him, I get a really clear idea what hemostasis is all about. So when after I finished my fellowship, when I came back, accidentally the head unit of hemostasis is empty. There's sort of like there was a specialist who's taking over the unit, but he had at that time she was taking care of 3 units at the same time, because not many lecturers were there at that time. So straight away she gave the unit to me, so I became the head unit of hemostasis. From then, I came back until now. Yeah, so now I am the head unit for hemostasis as well. And then from then on, start to apply grants and do research. I start doing research related to the topic, because when you become a specialist, you really, I think, need to find a niche, for yourself to do research. Although you basically can do any topics in hematology. Hematology is so vast, a lot of things you can do. But when you reach a specialist level, sometimes you need to find your niche. That's why here we have a subspecialty. You do a subspecialty. You pursue and do a subspecialty. Let's say if you are a surgeon, right? You pursue to do sort of like a hepatobiliary surgeon, or you do a endocrine surgeon. So that's what you call subspecialty. So that you become really, really good. You become an expert in that field. Yeah. So after graduated, that's not the end of story. Basically, that's what I'm saying. You can do a lot of things based on what suits you, what suits your character, your lifestyle, your support, and sometimes God's will. Sometimes you are sent, after your housemanship, you're sent to a department, a different hospital. Let's say you're sent to ENT. Don't be surprised that you're going to end up being an ENT specialist, because maybe you're familiarized with this topic, and then you just pursue. That's what I call God's will, I think. They will, you'll be sent to a certain unit, and then you become interested in that unit, and then eventually become a specialist in that subject. Yeah.
That's quite a very nice story. Could Doctor share with us the pathway to become a hematologist in Malaysia?
Okay, there are actually a few options. The main option would be to join our local program from the College of Pathologists. So you have to go through sort of like an exam, for intake exam, and then go through an interview. For those, so normally year in year out there are too many applicants for pathology. So if you didn't get the local program, there are a few parallel pathways that you can explore. So one of them is the Royal College of Pathologists of Australasia, from Australia. So you can apply to become a trainee in FRCPA, and you can train in the accredited training center. So in Malaysia, our university is one of the accredited training center for the college. It's already accredited, so you can do the training here in UKM in my laboratory. For our laboratory, only Haematology and Pathology are accredited for training for the RCPA. So other training accredited training center are Samuel Medical Center, University Malaya, USM in Kubang Krian, and for the Ministry of Health is Ampang Hospital, Kuala Lumpur. So those are a few accredited training center for Australian Royal College. The other pathway is the Royal College of Pathology of United Kingdom, MRCPath. You can join, but I'm not quite familiar with that program. But you can always Google and find out. So those are a few options that you can try and explore if you want to do and become a pathologist.
Is there any difference between these?
The difference is they are different board. Like for FRCPA is an Australian board. For MRCPath is a United Kingdom board. And then of course our local is from University Kebangsaan Malaysia. And University Kebangsaan Malaysia is a conjoined board between few universities, University Kebangsaan, University Malaya, USM, UITM, and University UBM. Yeah, it's a conjoined board. So those are sort of like a pathway that you can try and apply to become a pathologist. Yeah.
And then for our audience who actually wanted to pursue this pathology, can Doctor please advise some pathway for them to become, and which pathway is Doctor most recommend?
Alright. So let's say if you after giving some thoughts and think that you may be interested in pathology. Actually, pathology is, if it's not the topmost, it's one of the most sought after master's degree, or nowadays we call it DR, Doctor of Pathology. We used to call it Master of Pathology, now we call it Doctor of Pathology. It's one of the most sought after subjects, especially for the ladies. Not only ladies, gentlemen also, like forensic. Some of my students are men. What you do is you try to apply, to do attachment or to become an MOs or houseman. Try to get the place to do attachment, and then if you after you've completed a few years of MO-ship, you are eligible to apply for Doctor of Medicine, masters, and based on their requirements, or sometimes they have interviews, sometimes they have entrance exam. So you apply and join the program. If let's say you're not sure, what you can do is probably to do a sort of like a short attachment if it's allowed. Depends on which hospital that you apply to. Some hospitals are quite easy to apply to get a feel of what pathology is all about. Or I think what we have now in your program during year 4, some of you will be I think we have the research, sort of like research program period, SSM, Special Study Module. Some of you will be doing pathology research. So that will be one of the exposure. So maybe some of the students will, hey, this is quite interesting, or this is me, I would like to do this. So, and you can tell your friends, from your experience, actually quite interesting, quite nice, and very well sought after, and it's a good subjects to do, suits your sort of like schedule or your lifestyle. You can tell your friends. So that's one thing, to get to know what pathology is all about. The other thing is, if you are interested, you can always approach any of the pathologists and talk to them and see what they do, and probably can have a visit to the laboratory and have the feel of it. Sometimes if you like it, you like it. If you don't like it, probably maybe you don't. Other subject will be suitable to you. But there are ways to get to know pathology. So that would be probably ways of getting into the program or doing pathology.
Find the interest, whether we got an interest in pathology.
Yes. That's right. And I'm not surprised that people will become very, very interested in pathology actually, because in terms of the work balance, life balance. I'm not saying that other subjects there's no life at all. That's not true. Yeah, but for example, one big example is if you're on call, you don't have to come to the hospital. You can do on call at home. You can give a consultation to your MO who's doing on call. Like the transfusion on call, you can just consult through phone, so you have more time during weekends or at night. That's one of the perks, I would say. And I would like to sort of like correct a wrong understanding or perception that pathologists, their work is only microscope. That is not true. That is truly not true actually. For example, right, in hematology, under hematology itself, there are many sort of like sub-specialty. For example, you can do a general hematology, you can do you can become a flow cytometry expert, analyzing the flow cytometry. You can become a molecular expert, interpreting a molecular diagnostic testing. Now molecular is in. It's a really everything is molecular now, and molecular medicine is very, very advanced nowadays. So we need pathologists to interpret the results and all that. And then you have transfusion medicine as well. Transfusion medicine, if you want to be a transfusionist, taking care of blood banking and any thing to do with blood procurement, blood transfusion. So it's actually quite diverse. And definitely not just microscope. Not just microscope. That is like a very, very wrong perception on pathology, for hematology. For anatomic pathology, yes, most of your work involve, I think, looking at the tissues and diagnosing, and a lot of microscopic work. But again, it's not all microscope. And under pathology as well, there are actually different subjects. There are hematology, anatomical pathology, microbiology, and chemical pathology. So those are different sort of like subspecialty of pathology that you might want to venture if you're interested.
Thank you, Doctor.
But since I'm a hematologist, I would say hematologist is the best.
So just now, like Doctor had mentioned just now, other than hematology, there are also other subspecialty in pathology. Can Doctor share with us the difference between this?
Yeah, under the umbrella of pathologies, there are actually 4 subspecialties. Normally in first years, you do sort of like what we call a basic sciences, basic pathology. You go through the training in all 4 subspecialty. There are microbiology, pathology, anatomical pathology, hematology, and chemical pathology. After you pass your part 1, this is for local program, our local program. So once you pass your year 1 exam, then you choose what subspecialty you want to do. And they are quite different. For example, microbiology dealing with diseases, infections, and immunity. Hematology will deal with diseases that belongs to blood, any diseases associated with blood. For anatomical pathology is diagnosing from tissue biopsy. Yeah. So they will analyze and give a diagnosis similar to hematology. And last one is chemical pathology, to do with diseases involving with like biochemical markers, liver, kidney, and other diseases that requires certain tests, special tests for diagnosis. Endocrine diseases, a lot more actually. In chemical pathology. So those are the 4 subspecialty in pathology. So you can sort of like, if you are interested in pathology, you do have to choose what subspecialty you want to do. But there are also certain country that actually do a program and will produce general pathologists. They are sort of like jack of all trades, meaning you can do all, but not really in depth. For us, for example, for me, I'm a hematologist, so I learn in depth about hematology. But in our local setting, we do not offer that degree, a general pathology. We do not offer that degree. We do a subspecialty exam under pathology for the 4 subjects that I've mentioned just now.
So like the general pathologist means you learn everything.
You learn everything, exam, and you basically can sort of like manage certain things, but I think not as in depth as if you do one subspecialty.
So like for example in Malaysia, they got subspecialty, so you can, if you become a hematologist, you can only do the hematology.
That's right, yeah. Nowadays there are enough pathologists for subspecialty. For example, if you have a sort of like a rural hospital, we have enough pathology for each subspecialty. That means for that hospital we have 1 microbiologist, for example, 1 hematologist, 1 innate pathology, and 1 chemical pathologist. Last time, general pathologist is useful in the sense that, for example, in rural hospital, they don't have different labs. So that general pathology can sort of like cover all. Transfusion is important, right? And certain diagnoses. But we do not offer general pathologists now, in the sense that we have enough subspecialty pathologists to cater for almost all big hospital in each country. Yeah, so and for that reason, we do not offer general pathology degree.
We have enough subspecialty.
Yeah, each to cater for certain hospital, for each country, for each negeri, I say. Yeah.
And then the next question is, because we know that if you want to become a hematologist, you can do it with internal medicine specialty, and so you can also do it with a pathology specialty. So can doctor clarify a little bit the difference between these two?
Right. For hematology, right, we have clinical hematologists and clinical hematopathologists like myself. The difference is that for clinical hematologists, you have to do general internal medicine and become a physician. General physician first, and then you subspecialize in hematology. Then you become a clinical hematologist in charge of patients with the blood disorder, right? For on the pathology side, right, you join the pathology program. You do not have to join the internal medicine and do the exam. You join the pathology program and do the exam. And if you are interested to become hematology, you do a hematology part of the pathology and become hematopathologist. Yeah. And you'll be dealing with diagnostic work.
So one is with the blood disorder, the other one is diagnostic work.
No, one is in charge of the clinical aspect of patients in the ward, managing the patients in the ward. One is also hematology, but diagnosing blood disorder. You do a diagnostic work. You do the diagnosing the blood disorder. One is managing patient with blood disorder. One is diagnosing blood disorder. So it's quite separate. But I mean, if let's say you can do both, you can do both. You can be a general physician, subspecialty in hematology, and become a clinical hematologist. And if you are interested to do lab work to diagnose your own patients, you can do a double degree. You can do a pathology side of hematology and become a diagnostician like me, you know. So you have a double degree, you can manage patient as well as diagnosing patient. Should I say the other way around, is you diagnose your own patient and then you manage them in the ward.
You can do both.
Yeah, some clinical hematologists here in Malaysia are also there are a few that have a double degree. There are pathologists as well as a clinical hematologist.
Then for the pathology specialty program, local program, right? Can doctor like explain in detail like in the context of the course, the duration maybe,
Alright.
the course structure?
Yeah, in general, I think for local program in any subject, I think in every specialty is a 4-year program. Yeah, it's a 4-year program. As usual, first year, second year, third year, fourth year, and you will have to do a research project. For local program, you have to do one research project, and then normally there are 2 exams. One maybe in first year, one maybe in third year or fourth year. Yeah, and you have to go through the fourth year and pass all the exam, and then you become a specialist, and you can register as in the NSR system, a National Specialist Register System, to register yourself as a specialist. Then you can practice as a specialist in a certain subject.
The course?
The course, normally you can get a scholarship, or you can get a loan from the JPA, then you can pay later, or you have to sort of like bond with the government, for example, work with them for maybe 5 years, to sort of like pay back the money that they give you during the program. Yeah, that's normally what we do. You get a scholarship and then you're bond with the government for a couple of years for service.
So this is for the local program, right?
Yes.
And then for the others,
other parallel program, you have to pay for yourself.
The course structure is actually the same.
For Royal College of Pathology Australasia, it's actually 5 years. Yeah, and also you have to do research, where you have a few exams. 5 years. For MRCPath in the United Kingdom, I'm not sure how long. Maybe it's about the same.
So the year is 4 to 5 years.
For about 4 to 5
Major
years.
difference is the cost.
That's right, or the cost. But recently, the Royal College Pathology of Australia have actually in their board meeting have actually endorsed that for certain country like Malaysia, the fees is cheaper. They have revised because it's too expensive sometimes. They have revised it based on our income and all that, so it's cheaper for certain country like Malaysia. Cheaper.
Okay, so just now, Doctor mentioned that you have been to the Australia before and also the UK before. And can Doctor please compare the medical training between Malaysia, UK, and also Australia?
Okay, I would say it's essentially the same. It's 5 years program. Only that when I was there, I mean, definitely I'm much older than you guys. So when I joined the medical school, it was still a traditional course. And traditional course, meaning at that time for first year and second year, we learned anatomy, pathology, physiology, biochemistry, and that's it. There's no teaching like nowadays. You have PBL, you have no such thing. So it's just lectures in the morning and lab work in the afternoon. And then we were only introduced to clinical work when we were in third year. Then only you go to the hospitals and then start learning how to clerk and to examine patients and the rest. Yeah, so it's quite different. But essentially it's the same, lecture based, and then in clinical years you have to go to the ward, you have to do clerking, physical examination. Teachings are there, it's the same. There are tutorials, there are also lectures, and small group discussion, it's the same. Of course, in UK there are 4 seasons. In Malaysia, right? Shine and rain. That's the weather. But otherwise, I would say it's the same thing. Yeah, same thing. Yeah.
Do you enjoy the time in UK?
I did. I think because I've never been overseas before I went to UK. That was the first sort of like my overseas experience. So I was excited. I was excited. I was young and excited to be, in a different country. So I did enjoy very much. And luckily, when I went there, I was not alone. There were 3 others who's doing medicine from Malaysia, my batch, and I know them already during orientation week, and when I did my A-level, I knew them already. So it was not daunting in that sense. You have friends. We went to school together, so that's fine, and we stayed together also as well. We ran a house. And the other thing that is interesting is, of course, because you have a Englishman and English woman to teach you. So that's a different experience. They are very gentle teachers, I would say. But I think your lecturers, I don't know, I dare not ask whether they're garang or not. They're very fierce. I don't think so, right? Gentle. So yeah, they're nice, They're nice teachers, and they involve you in discussion. And I'm not sure, maybe you know me, Yue, from PBL, but the way I approach students is similar to how I was as a student. The lecturers are always very kind, very gentle, and very friendly to students, because you guys are actually not young, you're already adult, sort of like adult age. So we treat, I like to approach the students, the way I teach now is I approach the students similar to how I was when I was a medical student. I think that's the best. Even for the problematic one who came late to PBL, I will just scold a little bit only lah, still I can accept it. So my approach is similar when I was a student. Yeah. The other thing is, I think probably one thing different, if you like to ask me, the way the lecturers, they sometimes they take you out for drinks, a cafe or coffee, having coffee together, which we don't see that many. I don't know, maybe you guys have your own experience, like the lecturer sort of like, let's go and have coffee together in a cafe. That's why we have cafe down there. It's for you guys to sort of like know your lecturer as well, get to know your lecturer. I think especially it's important when you are in clinical year, after lab, after ward round, sometimes we go for drinks. To sort of have a close relationship with the students, so that students won't feel too scared, relax, and feel very comfortable in the ward. That's one thing. And the consultants they like to have discussion with students as well. I think that we have here as well, with consultants and teachings and talk to students. Yeah. Otherwise, it's the same thing.
Thank you, doctors, for the answer. Just now we also have discussed about the work-life balance stuff. And then actually I was quite curious, doctors as a researcher, as a lecturer, and also as a mother, how doctor can manage, how to catch the balance point between them?
Okay, that's a very tough question actually. I wouldn't say my life actually was smooth sailing. Of course, you have your ups and downs. That's life, you know. And at times it becomes very tough. Especially, I think the toughest will be when my kids are young, you know, toddlers, young, and need your full attention. That's when it becomes very, very tough. And at the same time, at that age is where you pursue your masters, your specialist. But you were young. At that age, you were young. You're between 20 and 30s. So you still have the energy, you still have the passion, you still have the sort of like energy and your will to live and to survive. I think that would help you guys in the future during that period of tough time. I would say that would be the toughest period, where at the same time you need to pursue to do your specialist degree. At the same time you start to have a family, have young kids. But at that time, it's when you need the most support from your family. Yeah. For example, if you have your family to help you out with young kids while you are on call, for example, while probably you and your husband is on call at night, there's no one. Some of them will bring their kids to hospital and, you know, just for a while, you know, ask them to stay in the on-call room, for example, while you're judging, you and your husband is judging your time. It's tough, but can manage. I don't see anybody who has failed to manage young kids. And don't be surprised, many lecturers here, sometimes they have 5 kids, 6 kids, or even 9 kids. So that means it's doable. It's tough, but doable. And at that time, you just have to be strong, you have to be patient. And the thing that you have at that time is energy. You're young. So make full use of your energy and your sort of like spirit to pursue your specialist degree. You get there. Once you pass that stage, it's gonna get better. Don't worry. It's gonna get better as your children become bigger. You're more stable financially as well, so it will get better. It will not get worse, hopefully. Of course, some people, you know, things happen and all that, but in general, things will be more smooth as you know, go further in your life. Yeah. Work balance is tough, but it's doable. It's doable no matter what. And I would believe that medicine is one of the toughest career to have, but it is not the end of the world, right?
Yeah, it's not the end of the world.
It's not the end of the world. Anything bad happen to you, it's not the end of the world. There's always a solution. Can go through it. Yeah. So that's how I approach my life at that time. You know, so and try to balance things. It's difficult, but you manage.
Actually, you can do it.
Of course, yes.
So other than these time management challenges, is there any other challenges that doctor have faced like becoming a pathologist?
I think because when you study to do your specialist, it's always tough because you have to read a lot and you have to pass through the exam, right? The exit exam is always tough because it's an exit exam. It's always tough. So the studying bit is, of course, taking so much of the time and effort. So that would be the toughest sort of like challenge. The other thing is, for me, I already have 1 kid at that time. 1 kid. Having to struggle to find a place to send your kids, the best place to send your kids, and then you have to pick your kids, send your kids, cooking and all that. Of course, in general, you know, all the domestic work that you have to do. So that's when you start to have helpers or your family to help you, and sometimes there are problems with the helpers and all that. So all the common things that happens in life. Otherwise, I think the thing is, if you have enough support, you have to have support. If you have a family, you have to have support. good support. That will help a lot. I think it will be quite difficult if you do not have that support system. You probably may become overwhelmed with the work that you have to do, with the on-call. Sometimes depends on which hospital. Certain hospital can be very, very busy. So the support is very important. I think that's one big thing that you need to make sure you have is the support system. Yeah.
So you have to like find support system.
Exactly. If not from your own family, from the helper to help you manage with your life, to balance your work and life. Yeah.
Yeah, I can understand that the support both physically and also emotionally
Exactly.
is quite important.
Yes.
Thank you, doctors. So I think it's approached the end of our interview today.
That's it.
Doctor can got anything you want to share with us?
Of course, I would like everybody to try and get familiarized with haematopathology, get to know if you are interested. And I must say that it is quite a promising branch of specialists where you can be a lecturer, you can become a specialist, and you can work in a government hospital, you can work in a university hospital like University of Malaysia Medical Center, and there's always a prospect of a private hospital as well. So and to me, if you ask me, I would say I'm glad to choose this specialty. It suits me very well. I have I think enough time for myself, for my family, and it gives a very good sort of like life balance. At this time, I really feel glad I choose this specialty as to pursue as a specialist. Yeah. So whoever is interested in pathology can come and see me and talk to me. If you're interested, I can tell you more.
Alright, thank you, doctors. So just like one question, if there's a chance for doctor to change to another specialty.
Oh, okay. What would it be?
Yeah.
What would it be? I can't think of any actually. I can't think of any specialty that I might pursue if I do hematology. I might become a businesswoman actually, not a doctor. Not a different sort of like subject in medicine. I would probably do something different from medicine.
So other than medicine, actually, doctor also like considered doing business.
Artist.
Art? No.
Do painting. I like to paint. That would be something I'd like to do more. Maybe when after I probably complete pension, I would probably start to do more painting actually, or maybe do some small business.
So got any advice to like medical student now?
Right. My advice is go study hard. You have to, of course, everybody have to work hard if you want to be happy. That's common for everybody. But don't look back. All right, look ahead and try to achieve anything that you dream of. And try to, if you become a specialist, be a specialist who contribute as much to the community. It doesn't matter, be a lecturer, contribute to the students, or specialist, contribute a service to the community, and try to do as much as you can. But at the same time, have again work balance to your family, right? Because family matters. Yeah. I think that's all. Yeah.
So Alright, so I think it's come to the end of our interview today. Thank you very much, Doctor.
You're welcome.
Doctor, for like spending time to do this interview with us, and then we like really learned a lot from this interview. I think that's it for this episode. See you in the next episode. Bye bye.
Bye.